like to introduce our second speaker, who is Associate Professor Nicholas Wilcken, and he's speaking today on breast cancer risks. So Nicholas is the Director of Medical Oncology at the Crown Princess Mary Cancer Centre at Westmead. He's the Senior Staff Specialist at Nepean Hospital and Associate Professor of Medicine at the University of Sydney. And Nick is also a Board Director at Breast Cancer Trials. So he's joining us from Sydney today. So hi Nick, how are you?
Very well, thanks Anna, and welcome everyone. What I'm talking about is what things might put you at risk of breast cancer. Sorry about that. What I want to do is just make a few brief comments about what causes breast cancer, which is obviously an enormously complicated question, and then just have a look at some of the things that might increase the risk of breast cancer, and then what one might be able to do about that to try and alleviate some of those risks. And really the point that I wanted to make about the causes of breast cancer is that for the most part, breast cancer, and in fact many cancers, is really just a result of random bad luck. And that's because every time our cells divide, they have to make an exact copy of themselves. And of course, once in a while, mistakes will be made, and the body is smart enough that most of the time it fixes those mistakes. But every now and then it doesn't. And if it makes a mistake in the DNA, which is the sort of instruction manual in all the cells, the cell can start getting the wrong message. For example, it might get a message to just keep growing and not stop growing. And over time, that can then develop into a cancer. So that's why when we're looking at breast cancer risk factors, I've got in sort of big and red here, two things that unfortunately you really can't do anything about, but they're really the main reason that people get breast cancer. Being female, males can get breast cancer, but it's pretty uncommon. And getting older, because the older you are, the more times your cells have been dividing and the more chance is that they'll make a mistake. Of course, breast cancer can affect younger women, and we'll hear about that later from Professor Lindemann, but the average age of getting breast cancer is about 65. So what about the things that maybe we can do something about? There are some hormonal factors, and I find the easiest way of thinking about that is to think about things that might expose you to more than average amount of estrogen. So that might be tablets like oral contraceptive or HRT, hormone replacement therapy, or it might be that you started getting your periods very early and you finished getting your periods at a later age. Now, obviously that bit you can't do much about, but the tablets maybe you can. And in relation to the oral contraceptive, the first thing I would say is the effect on breast cancer is very, very small. So do not go out and stop your oral contraceptives, because oral contraceptives do a lot of other good things, including obviously stopping you from getting pregnant when you don't want to get pregnant, but they also, for example, halve your risk of ovarian cancer. So we don't think that that's something that you need to be concerned about. But HRT is a bit different. 20 or 30 years ago, there was a school of thought that probably all postmenopausal women should just be on HRT for many years. And it turns out that that's wrong. And that definitely increases your risk of breast cancer. And so what you want to do is either avoid HRT or at least limit your exposure to it. So if you've got, for example, very bad menopausal symptoms and you really need some help, then maybe you do go on HRT, but you try and manage with the lowest possible dose and for the shortest possible time, and perhaps try and be on it for only a year or something like that. Sort of thing to talk to the local doctor about. In terms of lifestyle factors, there are also some things that we can do something about, although it's not always easy. So being overweight, especially in the over 50-year-olds, is known to increase the risk of breast cancer. Alcohol increases the risk of breast cancer. It doesn't mean that you can't drink alcohol, but it does mean that you should limit that intake. And exercise is important, and you'll hear more about exercise later with Professor James. And lastly, so there are some genetic factors, and many of you may have heard of these BRCA1 and BRCA2 genes, or so-called Angelina Jolie genes. And some people are born with mutations of that, and you can't do anything about what you're born with, of course, but you'll hear from Professor Lindemann about some things that we may be able to do to try and reduce the risk of breast cancer in women with those mutations. This is a list from Kellyanne Phillips, a medical oncologist at the Peter Mac. If you read the internet, you can find obviously enough rubbish if you try hard. These things do not increase your risk of breast cancer. Underwire bras, underarm deodorant, silicone implants, stress, despite what everyone thinks, drinking soy milk, there's a bit of a story about that, it's not true, and also either having a miscarriage or a termination of pregnancy. Those things do not affect the risk of breast cancer. How do you work out what your risk might be? There's a number of different tools. The one that I put up here on the screen is because, firstly, it's very good, and secondly, it was developed with some funds from breast cancer trials and a team headed by Professor Kellyanne Phillips. So this is an online tool, and it's important to be aware that this is for women. This is for your risk in your lifetime of developing breast cancer if you do not already have breast cancer and you do not have one of the BRCA mutations. If you do, then there are different tools that can help you. And I'll come back to talk about just how that works. But if you want to look it up, that's the website. And if you can't remember that, if you just Google, while we still got Google in Australia, if you just Google I Prevent, that comes up to the top of the list because I did it yesterday. If you do that or use some other tool, then you'll find that you will end up being placed in 3 boxes. And it's important to look at the numbers associated with these boxes. So from left to right, 95% of people will, on that calculator, turn out to have either average or what we call slightly above average risk. And it's most people who go on to iPrevent and other tools to check their risk of breast cancer generally learn that the risk is a lot lower than they thought it was, because we all tend to catastrophize a bit. In the green box is what we call moderate risk, so that's somewhere between 1.5 and 3 times the average risk, and that's only less than 5% of all women. And then 1 to 2% of women are at very high risk, and that's the group that Professor Lindeman's going to talk about in a minute. What do you do about these things? So again, from left to right, if you're at average or slightly above risk, you don't need any extra tests. You should do the normal recommended mammogram screening, which is starting at 50 and doing mammograms every 2 years. And there are some other common sense things that I'll talk about in a minute. If you're in that in between, that moderate risk, then you might, particularly if you're at the lower end of that spectrum, you might decide not to do anything extra. There is a case for potentially starting mammograms a bit earlier. We don't normally recommend that for the normal population, but if you're at slightly increased risk, there is a case for having mammograms starting at the age of 40. Or you might consider and need to talk to a doctor about trying a medication like tamoxifen, because there are a number of trials, including a trial run by breast cancer trials, that show that taking tamoxifen reduces your risk of developing breast cancer, and I'll show you an example of that in a second. And then lastly, there's the high-risk group that you'll hear about in a minute. So back to iPrevent, and so this is an example of a woman who's gone on to iPrevent, and she's answered some pretty simple questions about how old she is, her height, her weight, how much alcohol she drinks, how much exercise she gets, does she have relatives with breast cancer, and so on. And the numbers are pretty small, so you probably can't see. But this woman's been told that her lifetime risk of getting breast cancer is 20%. And that puts her in the moderate group, because she's also told that the average woman for her age has a lifetime risk of about 10%. So she's about double that, even though the risk is not super high. And the way they illustrate that is the figure down below, which is 1,000 icons, so 1,000 people. So it's saying, what if there were 1,000 people identical to you, what would happen? And the first and important thing to note is that 800 of that 1,000 would not get breast cancer. And then down below in the purple and the pink, about 200 out of the 1,000 would get breast cancer. And if those women took, say, tamoxifen, then that goes down to about 160 would get breast cancer. So just the pink one. So the purple there is women who have taken tamoxifen, and that's prevented them from getting breast cancer. So in terms of the other common sense things, if you're at normal risk or at the moderate risk that you can do, are the sort of things that I guess we should all be doing anyway, which is having a healthy diet, getting exercise, that you'll hear me more details about later on, limiting alcohol intake, maintaining a healthy weight, not always easy, doing the regular mammograms from the age of 50, and either avoiding or at least limiting your exposure to HRT. So that's really been talking about what might increase or reduce your risk of getting breast cancer. And I haven't sort of focused on what happens when you do get breast cancer, which Prue was talking about. But I think it's worth sort of finishing on a positive note, which is that the results we get if people do develop breast cancer are getting better and better. And you can see on those graphs, the UK and the USA on the left and us, Australia, on the right, that from about 1990, when we started getting the readout from clinical trials telling us about what the right medications and the right screening and so on has done, the death rates from breast cancer have plummeted. And so as oncologists, we are well aware that terrible things can happen to women with breast cancer, but 85 to 90% of breast cancer patients are actually alive many years down the track. And I'll finish there. Thanks.
Well, that's a great endorsement, Nicholas. I think that last slide about the importance of research and the difference that it has made over the years, particularly the last 20, 25 years.
And it's amazing because that dramatic fall in mortality has happened at the same time as the actual incidence of breast cancer in the Western world has increased. So despite the increase, we've managed to reduce the mortality.
Well, I did see a report from the World Health Organization this week that breast cancer has now become the most diagnosed cancer globally, which is quite staggering. But I think the positive news is that more people are surviving their breast cancer than ever before.
Absolutely.